thrilled to have you all here. We've worked hard on this endeavor, and this is something that I know. If you don't know the history of the Williamson County 708 Board, in 1968, it was put on a referendum for a portion of our real estate taxes to go towards mental health care. Centerstone has been basically the only organization that has utilized those funds up until now. And they've done amazing things, and they have been, had a huge presence in our area. However, as a board, we determined that there are a lot of new, innovative programs that are also serving the people of Williamson County. And so they really should have a chance at getting some of this funding that the taxpayers are providing. So we kind of changed the entire process, made it more like an RFP process or a grant process where organizations that are not-for-profit could apply for funding for their programs. And so they can either help fund their current programs, help fund expansions of their current programs to be able to serve more of our residents. And that's what we were looking for. And so instead of funding one organization, we are very, very pleased to announce that we are funding 9 organizations. Awesome. So it's been quite a process. We did a lot of research on it to see how we should move forward with the process. And I will say that this is not something that is uncommon or out of the norm. 708 boards throughout all of Illinois and throughout really the nation are mostly doing a process like this. And so the documentation, the rubrics, the forms, all of that, we did not come up with on our own. So those were things that other 708 boards are utilizing. So we're very proud of this, and I know we all feel really good about having you. If you would come up, Centerstone, we are providing $40,000.
Centerstone, as she explained, gave the history of how we came to be and formed, and now we are offering services, mental health, substance use treatment services in 9 counties in Southern Illinois, and then we also offer veteran services nationwide. And what the work that we do in Illinois is only part of it. We're also in Tennessee, Florida, Indiana, and always looking to grow our partnerships with people. So,
kind of a suicide prevention group for veterans, and we do that through teaching them how to train their own service animals. We usually spend about a year to a year and a half with our veterans. They can actually stay with us as long as they like. We don't ever kick them out, and in the end they get a wonderful service animal, and it helps them to be able to cope with the things that they've gone through, whether they're a combat vet or whether they've had some kind of trauma in the military. So it's a great deal. We started a little over a year ago, I'm sorry, and we started with 1 dog, and now we're up over 20 dogs. Wow. So we just added 2 more this week, and I've got another one waiting in the balance to come in and become part of our group. So very proud of what we've done, and it doesn't cost the veteran a dime. So we pay for everything.
That live in my home are all behaviorals, and I'm a CDP, which is a certified dementia practitioner. I'm also going to school for mental health instructors.
Organization for Restoration 61 with victims and survivors, really, of human trafficking. That's what Restoration 61 is primarily doing. In Williamson County, we have what is known as counseling and other services like red light therapy and neurofeedback and things like that, just to help people get through the difficult things that they're wrestling with.
We have a homeless crisis going on in Southern Illinois, so we know that that's also a very important agency that we felt we needed to fund, and that's $30,000. Do we have somebody from Coalition?
Good afternoon. My name is Camille Doris. I'm the Executive Director for the Southern Illinois Coalition for the Homeless, and this is Dave. He is our board president, so we're very thankful that he came along. And obviously we have an active wonderful board. So we've been around since 1989 providing supportive housing. We have permanent supportive housing, transitional housing, and another form of permanent housing that we call rapid rehousing. Some of our housing is earmarked for individuals with substance use backgrounds, but the bottom line is the majority of people that we serve come from, you know, a traumatic background. The fact that you're homeless in the first place is traumatic, of course, but they come from some sort of trauma background, addiction. And so we have houses and apartments spread out throughout Southern Illinois, and about 42% of our applicants and clients come from Williamson County. We serve the lower 24 counties. So we're just very thrilled to be a part of this, and what we do ongoing is help people maintain their housing. And so that's different for everybody. And our case managers are wonderful at linking people to some of your services as well as supporting them throughout the process.
Shawnee Health Service, we have two sides of our organization, the clinical care component where we're providing behavioral health, we are providing primary health services as well as dental services throughout Southern Illinois. Then on our social service side of the organization, providing counseling services, providing substance use disorder services, working through adult protective services, a number of different organizations. We help about 85,000 clients and patients on an annual basis across Southern Illinois. So the funding that we're getting today, we're going to be utilizing to provide care for mental health counseling and services at the Johnson City School District. We provide that at no cost to any students in need at that school system. So we're very honored to be able to do that work.
So I'm Sarah Van Boer. I'm the Director of Events and Outreach. This is Jackie Welch, who's one of our coordinators. And we'll be using this funding for the Southern Illinois Drug Awareness Conference. The funding will help offset the expenses for people to attend the conference. We can keep the expenses as low as possible. We'll discuss the intersectionality of substance use, mental health, and homelessness, bring together people from multiple agencies to be able to bridge gaps, discuss sharing of resources in order to help people find better and more efficient paths to recovery. And so one of the many things we do is host a variety of conferences, and we do really appreciate the funding because it does help really offset our expenses, so thank you.
That's great. Well, Take Action Today is a 501c3 not-for-profit. Some of you guys may have heard me ramble on if you're ever around any type of substance use, behavioral health, homelessness. As Michelle mentioned earlier, homelessness is on the rise. One thing we know for sure, behavioral health workers are not. There's a huge behavioral health workers. What our organization does that's unique is we empower people in recovery from substance use, incarceration, homelessness, trauma, a lot of these issues in this intersectional challenge we call homelessness. We empower them to become professionals, to receive professional certifications, and then work as grassroots community-based behavioral health professionals. We currently, in Williamson County, we operate 2 resource centers, one in Johnson City, which was our pilot resource center back in 2021. So since that time, we've grown to have 6 resource centers. At that time, we were a fully volunteer organization. We now have 20 full-time staff. Our other resource center is here on Broadway. Both resource centers provide showers, laundry service, food service to people experiencing chronic homelessness, chronic substance use. Typically, the people that we deal with are the people that nobody else has been able to help until that point. So we really try to do all we can, which, as most of you guys know, there's not much in Southern Illinois to do. So for us, it's not only about developing service providers, it's about developing resource capacity throughout the region, because just as we see here tonight, as Michelle and this great board have seen, you can't just invest all your eggs in one basket. It takes a community to create change. And I think that's what we see here tonight, is you guys are creating a community of change in Williamson County.
To the mindset that when we work with Williamson County dollars, we want those dollars to stay in Williamson County. That's our main goal, and so that was the mindset of this board. And the money that we receive does come from the Williamson County tax levy. That levy incorporates a lot of different entities in there, and so that's where our money comes from. We get approximately $400,000 a year, and that comes every year. So, so it's not millions of dollars. I wish it was, but we're doing what we can do and trying to help Williamson County residents. Because as we all know, mental health services are so needed anymore. You see it every day on the news. So I'm very proud to be on this board, and I want to thank all my fellow board members for helping us go in this direction.